Before you get to the
Sure.
point of that caller, get to that phrase war on drugs. We've read you're not
Sure.
too thrilled about that phraseology. Tell us why.
Right. The first week that I was in office, I said we should stop using a war on drugs. It's been around for over 40 years. Quite frankly, with the drug issue, it doesn't make a lot of sense. When you talk about a war analogy, you pretty much are limited to the tools of force. And as we look at this as both a public safety and a public health problem, and we look at bringing much more into the forefront prevention and treatment, that would be great. An AP reporter called me not long after that and said, look, I just called 5 police chiefs up in Illinois because I knew that you were so wrong by ending the war on drugs. All 5 of these police chiefs where the AP reporter worked said, no, we shouldn't be calling it a war. I look back in my own long career, I actually don't remember police chiefs and sheriffs talking about a war on drugs. I do remember elected officials calling it a war. I don't remember those on the front lines calling it a war.
Whatever you call it, the caller's point said, what's been happening has been ineffective. What could you tell that viewer and others about the new policy and how that might be different from the past?
I think the new policy says that essentially in the last 10 years in particular, there's been much more research, much more effective research when it comes to prevention programs that work and treatment programs that work. And by having a more balanced approach to the drug problem, we actually have the potential to be much more successful by admitting that reducing our own demand is just as important as protecting our borders, cutting off supply, doing interdiction, but also working with other governments. We just helped Mexico, in fact, recently, last fall, open up their first drug court in Monterrey. And so we have something to give away besides night vision goggles and interdiction techniques. We have prevention and treatment programs that actually work and can be effective.